Welcome to your Nurse Companion, Africa and beyond, where care meets culture, where knowledge becomes power. It's not just a show, but a movement. We are going to bridge the health gap from the hospital bedside to your home and to your heart. I am ready to walk this journey together with you. I am your host, Caroline Wanjiru Mwangi, ready to walk the journey of health that you are in, to break any myths and facts, and I'm going to bring it right to your homes. Bye. Hi my people, how are you? You know, it's another episode that I'm bringing some juice, some good things, some real stories, and not just real stories, consultancy just in your house. And we went to the streets, we talked to the boda boda guys, walikuwa busy. We talked to Mama Mboga. We had these conversations, why a man not going to the hospital. And as your nurse companion, I am bringing the hospital to your house. Zile vitu tunataka kuuliza daktari, ninakuletea umuulize. So on today's show, we are going to have a surgeon who is dealing with men on the table. Wanaume wengi wanaenda hospitalini when it's too late. So all these things, you can only find them at your Nurse Companion show, where we bring surgeons, doctors, nurses, and clients who have walked different journeys of health and are ready to share. So today we are going to talk to surgeon Dr. Ogoya, who deals with men, female, children on the theater table. And he's going to give us some light. One, why are men not going to the hospital? And when they are going when it's too late. And then there are two conditions that he has been dealing with. Commonly, I would say even in Kirinyaga County, there have been two common conditions that he has been dealing with. So we are going to have an episode that is going to talk about prostrate enlargement, and then another one about hemorrhoids. These two things, how do they present? How do we know them early, detect them early, some of the causes, and how do we go about it? After you have been diagnosed, how do you go about it? It's an exciting journey that I'm ready to walk with you. So let's get started.
For those who don't know me, my name is Dr. Ogoya Madaraka. I'm a general surgeon, but I'm also an endoscopic and a laparoscopic surgeon, apart from just doing the normal open general surgeries. So now, men and health-seeking behavior. First, let me start by a story. I've been privileged to travel abroad. Now, when I was traveling, you know, this our kawaida business of taking juice, then when you finish, you just hurl your bottle over the window. So now accidentally I did that subconsciously. Now you could have seen what my host did to me. I will not go into that. So one thing is culture.
Yeah.
In Africa, men are the leaders. Men have been conditioned to be tough. Men are not supposed to cry or shed tears. Men are not supposed to show weakness. Men can't be sick. You know, there's that famous saying that if the center cannot hold, things fall apart. So men try to hold by force, by fire. Because now when you look like you're the one who is weak and sick in the bed, now the question is, how will your wife and children take it to be? So men are naturally, especially in Africa, I find the trend a little bit different in the West, maybe because of their cultures and their training. But in Africa, you find men try to look hard. And even when they have challenges and problems, until they're nearly shutting down, that's when you find them seeking help. Then another thing is that men are not as social as women. Men tend to hide their problems. For the psychologists, they understand. Thirdly, men are busy. To be honest, in Africa, men are basically breadwinners. So few number of times you find to rest, you find to treat yourself, you find just time to relax, and you know, it's difficult to go to a doctor and find that there's a man who has just come for a checkup. But most of the times in my office, you find the lady, maybe with the sons and the daughters. And if you ask, they'll tell you, oh, daddy is at work, daddy traveled, and all that. So uh, we have loved doing other things better than taking care of our own bodies. And I compare men to doctors and nurses because majority of healthcare workers, when they get diagnosed with conditions, they are nearly most of them are fatal. Why? Because they concentrate more on providing services to other people as opposed to looking at their own health. So they wear themselves out serving others. And now, when their turn comes, the body has compensated and overcompensated and overcompensated. So you find that they're just weak. By the time you diagnose them, probably the disease is so advanced, and most of the times there's nothing much we can do. Men also tend to have, men are naturally risk takers because, well, the trend has changed. But if you look at those things, I'm not saying they are evil or they are bad, it depends on how you view them. But okay, right now the trend is changing. But men are the ones who drink a lot, men are the ones who smoke a lot, men are naturally adventurous. So you'll find that a lot of these risk factors for majority of these things, they find men. Men are the ones you'll find out in the cold, walking, blah blah. But like I say, this trend has started changing. Nowadays, we find that women are actually taking them up more, especially after Beijing. You know, when they came from Beijing, they said what men can do, they also can do better. Well,
You can do
I don't
better.
know. The jury's out there, but that's story for another day. So good. Now let's start with prostate.
Yeah.
Uh, Prostate is a normal. Prostate is very vital for those who believe in creation, created by God for the purpose of Old Testament. Because for those of us who believe in the Bible and in the Word of God, the instruction in the Old Testament is go forth and multiply. But as men, you cannot multiply if you don't have prostate. Why? Because prostate is a very important and key organ. Prostate is located along a pipe. That pipe is a conduit for two things. Number one, sperms or semen. Number two, urine. So at the time that sperms are coming out, the opening for urine is blocked. At the time urine is coming out, sperms aren't supposed to. There's a way it has been created so that one leaves the way for the other. It's just like a green light and a red light in the traffic. So, what is the importance of prostate gland? Prostate gland produces fluid we call prostatic fluid. Prostatic fluid is what gives semen its quality, its fertility potential. It's the one that makes sperms motile or improve them. Sperms are naturally motile, but if they don't have a conditioning to make them move well, it's just like a vehicle. A vehicle is born to move, but you need it to have fuel and those catalysts to make it move. That's number one. So, for the health of the sperm, there are things that are in this prostatic fluid that are very important. Things like zinc, things like proteins, enzymes like acid phosphatase, enzymes like prostatic specific antigens. These are the things that make, after man ejaculates, they are meant to make the semen liquid so that the sperms can swim, so that they don't just go at one place and form a coagulum and get stuck. So those are some of the things that the prostate does. And that is why it's a very weird joke, but it is said that those who get their women from the coast, the women from the coast have been taught an art of massaging men's prostate during sexual intercourse. It maximizes the outcome. Wow, who taught them that and why they do it, I don't know. I have not experienced. That again is a topic for another day. But it's just the wisdom of creation. So well,
Yeah.
but now
The enlargement.
everything that God created can be both good and bad. So I've told
Yeah.
you the good side of the prostate. That's the good side, that it ensures that fertility and generations come forth. But the prostate can also be a challenge. Why? Because prostate is just made next to the pipe. Assuming this is a pipe, this is my pipe. The prostate is just sitting on it like a brother and a sister on the side.
Yeah.
So there's a part of the prostate that is called transitional zone. It is next to the pipe that brings out urine. And that part is the one that grows. And when it starts growing, it compresses the pipe for bringing out urine. That is called urethra. That is when men start developing these problems. And you see, anything that has growth has a balance of two things. It grows, but it reaches a certain time, some cells also have to die. So when the growth exceeds the number that die, that's when now we have too much. And that's when now men start experiencing this problem. Men have hormones, the hormone called testosterone. It is a very important hormone because without testosterone, you can't be a man. But testosterone also is drawback. In the prostate gland, there's an enzyme that converts testosterone into another form called dihydrotestosterone. So that makes the prostate gland to grow and increase in size. There are things that are also things like smoking, alcohol, obesity. The people have something called metabolic syndrome. Metabolic syndrome are people who have hypertension, diabetes, obesity. People who don't exercise. And exercise is two ways: the physical exercise and exercise of your sexual organs. As a man, if you don't exercise your sexual organs, it is theorized that you are most likely to get problems with prostate.
Yeah.
How it
Yeah.
works, we still can't really explain. Scientists are still doing studies on it, but there are theories. You can go out there and find them out. So, prostate issues, which the key one is enlargement, the bad one is when you get cancer. It's a
Yeah.
disease of old men because after 40 years, there's an exponential growth of prostate. And then after 40 years is when men now start experiencing these things: diabetes, hypertension. You start becoming sedentary, you've made money, so life is here and there, you're just enjoying life and all that. So people forget to exercise, people forget to do these other things that should make them healthy.
Yeah.
Diets are important because when you eat diets that are good in fruits, fruits are thought to be antioxidants and anti-inflammatory. Inflammation is one of the things that makes your prostate to have issues. And that explains why people have obesity, metabolic syndrome, and all that. They get prostate issues because they are in hyperinflammatory state. Then there's a role of genetics. Probably the isoforms of the enzyme that converts testosterone into dihydrotestosterone. They are ones that are excessively active. So if you get that one, you inherit along your genes, then most likely you are bound to get prostate problems. So now, there's a famous joke that after 40 years, men, you don't do two things. Number one, you don't pass the next toilet.
You don't do what?
Number two, you don't waste an erection.
What? Repeat the joke again.
There are two rules.
Yeah.
After 40 years, men, you don't pass the next toilet.
Yes.
The second one, you don't waste an erection because they are very expensive ventures.
Wow.
Men, are you there? I can't see the men. Are they there?
After 40. After 40.
After 40. Okay, well, that's the joke. But anyway, so how do you know you are having this problem? Initially, you find that you're just passing urine well. Then there are these times that you find you can categorize them into two. There are those ones that irritates you, like you want to pass urine more frequently. You wake up at night to go and urinate more frequently than you used to do. Maybe the other times you used to sleep, maybe wake up once in the night. But this time you find you're waking up 7 or 8 times
Wow.
in the night. Those are warning signs.
Okay.
There are these people who, when they go, they can't just start.
So,
And when they start, they can't maintain the flow.
okay.
So you stand like for 2 minutes before you start. Then when it starts, it's just dripping slowly. Initially, you are hitting the
Yeah.
wall. Now, by that time, you can't hit the wall. Initially, you used to have just a smooth stream. Now you have a stream that goes, cuts off in the middle, then you start out dribbling. Then there are these men, when they go, they urinate, but they feel like the blood is not in. They want to go again.
You want to go again.
There are these ones who will have pain or burning sensation. There are those ones who will have blood in the urine.
Yeah.
And so all these things, and there are those ones, they tell you now, means siwezi kwenda safari. Because if it comes, if I'm not next to the toilet, it will just come out by itself. So it's like they don't have brakes.
Yeah.
So these are some of the symptoms. And the main thing that happens is that Once the prostate blocks the outflow, your bladder tries to compensate. And when your bladder overworks, then now you start having something called irritable bladder. This is now what you see with these complications that I'm saying. Now, the worst of them all is that over time you may have stones, you may have recurrent infections, you may have a lot of pain when you get a lot of inflammation called prostatitis. You may end up with prostate cancer, you may end up with damaged kidneys, which actually may lead you to uh, renal
I have a
transplant
question,
or
Doc.
dialysis before we
Is
correct
there a
it.
specific
So basically, that is the spectrum of maybe in a layman's language. That is what I wanted to know. Know the symptoms, know the
yeah.
risks, know the genesis, and I think now from there I can entertain questions.
So my question is, Doc, at what age can a man now say, I need to go check my prostate? Is there a specific age, even if they don't have the signs, or
Yes.
or they can do it as early as maybe you hit 40?
Mm. Now, there's one more thing that we need to know. There are things that can mimic problems of the prostate. Number one, if somebody has like been admitted and catheterized and accidentally someone injured the urethra,
Yeah.
then they can get something called stricture. So you might find somebody at 21 years with these things I'm talking
Yeah.
about. So it is another problem mimicking prostate. So that is why age is also an important thing, and history. When did it begin? What are the things that happened? There's this man who got venereal diseases, urethral infections, the gonorrhea, the chlamydia, and all that. And after that, they get the same thing, strictures. And they may come to you like 2 weeks ago. I had a gentleman who came to me with at 27 years. He had the same problems I'm talking about. Then somebody took an ultrasound and told him his prostate is enlarged. When he came to me, I told him, your prostate cannot be enlarged at 27. Hell no. So I sent him now for the another picture to check in the urethra. To my suspicion, it came out. And now when I took history, I found out that this man had suffered from venereal infections recurrently. And now they had caused a problem in the tract. So the message is not every time you have such kind of symptoms I've explained, it is prostate enlargement of prostate cancer. You may just be having stones. You may be having inflammatory conditions that affect your urinary system. So we should not say that it is only at 40 years when you get these problems is when we should suspect a prostate problem. It could be a prostate problem. It could be something that is totally different from prostate problem.
There's some.
You could have somebody who has had a disease of the spine or the spinal cord. They present the same.
Yeah.
Somebody could have had an accident with paralysis. They could present the same. Somebody could be having things like early on their nerves get. So the only key point I have for my fathers, my brothers, and my elders and all that is that when you start getting this kind of problems, pain on urination, weak stream, you go frequently, you wake up in the night, you try to push for the urine to come out forcefully, you urinate, you don't feel like it is enough. Initially you used to hit the wall, now you can't hit wall, blood in sperms, problems with the ejaculation that is combined with those urine problems, then you need to get checked, because even stones, even tumors, nowadays you're getting people with cancers. Tumors are cancers at very early age.
Yeah.
And those cancers can start. They are cancers, they are tumors and cancers. Tumor is a general term. But now when you talk about cancers, they are the bad ones, because you can have just a growth inside your urethra that is not necessarily cancerous, but it can present the same.
Yeah.
So every time a man experiences such kind of symptoms, the first thing is go for
Go
checkup.
for checkup.
Now, routinely, after 40 years, you watch out of these symptoms. What are the things that can alarm you? You are diabetic, you are obese, you live a sedentary life, you have a family history. Plus these things that I've talked about.
Yeah.
Then you go for screening. Screening is done in 3 parts. You walk to a doctor, he takes a good history, then he examines you.
Yeah.
From the examination, you will feel the prostate. He will examine you through the anal canal to reach the prostate.
Yeah.
From there, he can make
Yeah.
recommendations. The other screening is ultrasound. You can just take a simple ultrasound and see how your prostate looks like. The other one, they just do a simple urinalysis and see. The other one, they just do blood test to check the enzyme levels. So any of those can do. But if you are above 40 and you don't have much challenge, there is no harm passing by the doctor and getting a checkup.
So because I've seen you do the
50 years,
I have seen
by
you do
50
the
years,
test, Doc.
pardon?
I have seen you do the test where you use the gun. At what stage do you use do you take that, after you have done what investigation, now do you get to taking the sample?
Okay, so now let me finish. At 50 years, you're now getting into that age. Now by 60, 70, now that is the danger zone for prostate cancer. So by at least after 55, it would be good for you at least to get a checkup, either clinical, either blood test, an ultrasound. We divide them into three: the clinical one, the blood test, and the imaging. So the imaging is ultrasound or other imaging. The blood test plus urinalysis, and then the clinical exam plus history. Now, when we do screening, now we categorize people into three. There are those ones who are normal, there are those ones who have a small problem but need follow up, then there are those who have alarm symptoms. Now, the ones that you see me bring to theater and take a small sample from them is the ones that their imaging and their blood workups and clinical exam, or one of them, either both, either all the three, or one of them is suspicious. So when we see something that is suspicious, now that is when we take a small chunks of meat, not chunk, but very small
Very small
pieces.
pieces.
They are millimeter type. It's even difficult to see them with the naked eye. But because the pathologists study them through microscope, so we take them with a small needle. Then we submit them to the laboratory. Then they look at them, they study them. If they find any signs of cancers, then you are able to deal with them depending on the stage and the grade. Because again, not all cancers are operated, not all cancers are given chemotherapy, not all cancers are given radiotherapy, not all cancers are given hormonotherapy, not all cancers are done watchful waiting. So all those modalities I've mentioned are modalities of management. You can either just watch someone. For example, I find a 95-year-old man with prostate cancer. He's able to pass urine. Why would I want to put the 95-year-old man through the hassle of taking monotherapy, chemotherapy, and all that? He will die probably from his heart problem much more earlier than the prostate cancer. And now when you come to our practice, there are those areas that you find the clinicians debating. Uh, if I screen this man at this age and find him he has a prostate cancer, would I have brought more worries, more cost of medication and procedures and surgeries, vis-a-vis if I just let him live and see what natural course it takes? So there are those debates. But now those ones are patient specific.
All right.
And there are also guidelines that we follow, like our urology association. There are urology associations across the world. So they give out guidelines on what you're supposed to do.
Okay.
So we handle each patient individually and uniquely. And we categorize each depending on the risks and your expected survival. There are so many things that we can
All
see.
right. So I hope you have learned something, because I have notes and I'm going to go back and just take up some notes. Go know, when do I detect it early? Some of the things, some of the symptoms. Now, when do I need to get a checkup? Because those were key points that were talked, that he discussed about prostate enlargement. And at what time do I go? What I need to stop ignoring as a man? When do I need to? You have heard at 40, you know, they say life start at 40. Actually, screenings start at 40. Kindly go have the screening done. Have treatment done early. Do not ignore these things. So as you have heard from Dr. Ogoya, if you have any questions, if you have things that you want us to have him on live, that we can discuss detailed, if you want one-on-one consultation, kindly inbox us. We are going to get back to you, because this is where we get all real-time talk and real-time testimony of different kind of people and journey of health, only at your Nurse Companion Show. Are you a health practitioner that you want to create some did you want to give advocacy about something that you are seeing there is a gap, kindly let us know that we are going to schedule you and you're going to have you bring up some light on our social medias. And I'm sure you are learning something. If you have something to ask, you have a comment, put it down and you're going to get back to you. That's all for today. I hope you enjoyed and learned a lot. Bye.